I'm very reluctant to use antidepressants in bipolar disorder. And it can be very deceptive. If you have somebody in a severe depression and they're bipolar 1 or 2, and you put them on some antidepressant like Prozac or Zoloft or something, often a month or so later they've come out of the depression and they're doing great, and you feel like you're a genius. But then in the next year they're having more depressions than they ever had, maybe more highs too, ups and downs, but maybe more depressions than ever. And then you start piling on more antidepressants. But actually, what happened was you made them worse. Even though it lifted the depression for a while, then the benefit wore off and they're back down again. And you keep giving them more and more antidepressants, they get better a little while and then they're down again. If you just put this person on Depakote or Lamictal or lithium or some combination, they would likely have just gradually gotten better and then stayed better. And the antidepressants I really try to avoid. Now sometimes you can't. They're already on lithium and Depakote and Lamictal and they're still having severe depression that just doesn't seem to go away. And then you add in a little antidepressant. And you just have to observe and be careful. Sometimes you can get away with it and they can be on it for years. But sometimes you're deceiving yourself and they get better, but then they lose the effect and they're worse later on. 50% of people who are bipolar abuse substances at some time in their life. And many of them will have a long, difficult problem with alcohol. And it seems as if, well, there's probably a couple of reasons for it. One is if you're a little high, a little or manic, then you have less impulse control and you feel sort of invincible. So you're not afraid of going and drinking a huge amount and having a hangover the next day or possibly embarrassing yourself. And the second reason they use it is it makes them feel better. It's a way of self-medication. It calms down the highs, and if you're depressed, when you have the first few drinks, the first few hours, it can lift you out of the depression. It literally raises the serotonin and you feel much better. However, the bipolar disorder in the long run makes the bipolar disorder worse and it makes depression worse. And it's a psychotropic substance that you're really using a lot of, and it's just disturbing the brain. Now, another substance that we abuse commonly is tobacco. And smoking cigarettes raises the risk of more mood swings and also developing anxiety disorders like panic attacks. But people who smoke end up having more hospitalizations for depression than those who don't smoke. And we think this is because the nicotine is also changing these receptors. You know, if the nicotine or if the smoking itself is pleasurable, then you're raising the dopamine receptors at some point, and then they're having a little letdown, and you're constantly pushing them up and having them come down, and it's not surprising that this would increase some of the cycling in these mood disorders.